If you have children, elderly family members, or anyone with compromised immunity in your household, what I'm about to share could literally save their life. We're facing a measles resurgence that health officials are calling the most serious in decades, and most people are completely unprepared. Welcome back to Health Treatment Center, where we cut through medical confusion to give you the facts that matter most. I'm about to reveal the 5 critical things you must know about this measles outbreak, including the one symptom that appears before the rash that 90% of parents miss. But first, if you care about protecting your family's health, make sure to subscribe to Health Treatment Center and hit that notification bell, because this information is too important to miss. Let me start with something that might shock you. Measles isn't just a childhood rash anymore. The recent outbreaks we're seeing in this year are hitting adults harder than ever before, and the complications are more severe than most people realize. Here at Health Treatment Center, we've been tracking these developments closely, and what we've discovered will change how you think about measles protection forever. The first thing you need to understand is timing. Measles is incredibly contagious for days before the rash appears. That means infected people are spreading it without even knowing they have it. If this is making sense so far, type alert in the comments right now. The second critical fact involves immunity gaps. Many adults who thought they were protected are discovering their immunity has waned. If you were born between 1957 and 1989, you might only have received 1 vaccine dose, which isn't enough for the current strains we're seeing. The third thing that's crucial: early symptoms look exactly like a common cold. Fever, runny nose, cough, and red eyes. But here's the key difference that could save your family. Look for tiny white spots inside the mouth. It's called Koplik spots. These appear 1 to 2 days before the characteristic rash and are a definitive early warning sign. Comment below if you've ever heard of Koplik spots before. I'm curious how many of you know about this critical early indicator. The fourth essential fact concerns high-risk groups: pregnant women, infants under 12 months, and anyone with compromised immune systems face life-threatening complications. If you're in contact with any of these groups, your protection status becomes even more critical. The fifth and most important thing: what you can do right now. First, check your vaccination records. If you can't find them, a simple blood test can determine your immunity level. Second, if you're not immune, get vaccinated immediately. But here's what most doctors won't tell you about timing and effectiveness. If you've been exposed to measles, post-exposure vaccination can still be effective if given within 72 hours. Most people don't know this, but it could be the difference between getting sick and staying healthy. Here's something else Health Treatment Center wants you to know. Natural immunity from having measles as a child provides stronger, longer-lasting protection than vaccination. However, getting measles deliberately is extremely dangerous and not recommended due to serious complications, including brain inflammation, pneumonia, and even death. If you have questions about your immunity status or what steps to take, leave them in the comments below. The Health Treatment Center community is here to support each other with accurate, life-saving information. Now let me address something that's causing a lot of confusion: international travel and measles exposure. If you're planning any trips, especially to Europe, Asia, or areas with known outbreaks, you need to take extra precautions. The CDC recommends getting vaccinated at least 2 weeks before travel. But here's what they don't emphasize enough. Airplane travel itself is a major risk factor. The recycled air systems, close proximity to other passengers, and long exposure times create perfect conditions for measles transmission. If you must travel and you're not fully immune, consider wearing a high-quality mask and avoid touching your face during the flight. When you return, monitor yourself for symptoms for up to 21 days, because that's how long the incubation period can last. There's also a critical issue that Health Treatment Center has been investigating: the measles vaccine shortage that's happening in several regions. Some areas are experiencing delays in vaccine availability, which is creating dangerous immunity gaps in communities. If your doctor says the vaccine isn't available, don't just wait. Call other clinics, pharmacies, and health departments in your area. The shortage is real, but vaccines are still available if you're persistent. For parents, this is especially important because delaying your child's vaccination, even by a few weeks, can leave them vulnerable during peak outbreak periods. We've compiled a list of alternative vaccination sites that many people don't know about, including some community health centers that have maintained their supply when private clinics have run out. Before I wrap up, let me share the most recent data from health authorities. Measles cases have increased by 300% compared to last year, with outbreaks reported in 15 states. The most affected areas are communities with low vaccination rates. But travelers are spreading it to areas previously considered safe. Don't forget to like this video if it helped you understand the measles situation better, and share it with anyone who has children or works with vulnerable populations. Subscribe to Health Treatment Center for more critical health updates that could protect your family. Remember, when it comes to measles, preparation and knowledge are your best protection. Stay informed, stay safe, and I'll see you in the next Health Treatment Center video where we'll discuss the latest developments in infectious disease prevention.